Welcome to the training on Occupational Health, Environment and Safety. Let's begin with the module on seizure. Before we begin, let's look at the key learning objectives. After completing this session, you will be able to define a seizure, explain causes of a seizure, recognize signs and symptoms of a seizure, and demonstrate first aid for a seizure. What are seizures? Seizures usually indicate a problem in the brain. They occur because of sudden, abnormal electrical activity in the brain. A seizure is also known as a fit or convulsions. Click each tile to know more. Seizures are of two types: partial seizures and generalized seizures. Most seizures last from 30 seconds to 2 minutes and do not cause lasting harm. Their symptoms could be from mild to severe. Do you want to know the causes of seizure? Click each tile to know more. A rapidly increasing fever, a fever seizure. An extremely low blood sugar level in a person who has diabetes. Damage to the brain from a stroke, brain surgery, or a head injury. Problems that have been present since birth, congenital problems. Withdrawal from alcohol, prescription medicine, or illegal drugs. An infection such as meningitis or encephalitis. A brain tumor or structural defect in the brain such as aneurysm. Parasitic infections such as tapeworm or toxoplasmosis. A seizure can be a symptom of another health problem such as a blackout of time followed by confusion, uncontrollable muscle spasms, drooling or frothing at the mouth, experiencing a strange taste in the mouth, clenching teeth, sudden and rapid eye movements, making unusual noises such as grunting, losing control of bladder or bowel function. Now let's see how to provide first aid in case of seizure. Click each image to know more. Make the person calm and comfortable. Remove his or her glasses if any, and help him with a cloth or pillow to keep head high. Loosen clothing around the person's neck. Keep the person turning to one side, recovery position, to avoid choking. Note the time of the seizure. If it remains for more than 5 minutes, then need medical assistance. Do not insert any objects in the person's mouth. Do not give water or anything to eat. Do not hold the person as he or she may hurt you badly. After the seizure has stopped, check that his or her breathing is returning to normal. Stay with the person until he or she is fully recovered. Seek immediate medical help if any of the following occurs. Seizure lasts for more than 5 minutes. Breathing or consciousness does not return after the seizure stops. A second seizure follows immediately. High fever. Heavy sweating and rapid pulse due to overheating of the body. Person is pregnant. Person has diabetes. Person injures himself or herself during the seizure. Pediatric seizure. Click each tile to know more. Seizures are the most common pediatric neurologic disorder, with 4% to 10% of children suffering at least one seizure in the first 16 years of life. The incidence is highest in children younger than 3 years of age. Causes of seizure in infants and children: fever, brain tumor, infections. Diagnosis and treatment is very important at the infancy stage to prevent permanent disorders. Symptoms and treatment are similar for both adults and children. Now let's summarize some essential points that you need to remember. A seizure can occur due to high fever or low blood sugar. Its duration may vary from 30 seconds to 2 minutes. Cushion the person's head to keep it raised. Seek immediate medical help if the seizure reoccurs or lasts for more than 5 minutes. Infants are also prone to seizures. These should be treated in the early years to avoid permanent disorders.
Relax. Don't panic, just move back.
Move any potentially harmful object out of harm's way to prevent injury. Do not restrain the person and give him or her head support. After the seizure ends, move the person onto the side. Tilt his or her head back to protect against choking from possible vomiting. How to give emergency medical aid to seizure patients. Move any potentially harmful objects out of harm's way to prevent injury. Do not restrain him or her from moving. Provide head support and wait for the attack to end. After the seizure attack eases, move the person onto the side and tilt his or her head back to prevent choking.